Is there one procedure that you like doing best that you think gives the best results if someone can only afford one thing? Like, what is the thing they should be doing that will change their look the quickest and the most on their face?
So it's in terms of aesthetic procedures.
Yeah.
Aesthetic procedures. It's a tough question. I love the nose more than anything else, but I would think it's between the nose and the eyes. And by the eyes, I mean this
And
here in this area, the tear troughs. So
yeah.
when somebody has an indentation under here and a shadow falls into it, they look tired and they look older. Fill that in 5 minutes. They look 10 years younger. That's a home run. That's pretty good.
Wow.
It
Yeah.
lasts for such a long time.
And obviously the nose can really change anyone's face.
It's right there. It's right in the middle of your face. You
Right.
change that, you change person.
Right. You were talking about body dysmorphia for a second. It's become very popular. Some accounts looking at how crazy these people look, whether it's huge boobs and butts, the tiniest little body to make them look like a Barbie. There's one woman out of Russia. I don't even know if you know who I mean.
I
Has
know.
this huge.
Yeah.
I've actually asked her to come on the show because I just want to figure it out. I don't get
Yeah.
it.
They don't get
People
it.
are obsessed with her, and I've seen the before picture of her. I mean, she was this like kind of plain Jane, little innocent thing, and her cheeks are out to here. Her face is in a. Why do people do that? Do they think it looks good? I'm so confused by what's going on with them.
I I think to some degree people do this because when you're looking at yourself, you're at a disadvantage. You, by necessity, when you look at yourself, look at the trees and not the forest. You don't see the full picture. It's hard to see in the mirror. It's actually easier to see the full picture when you're looking at a photograph of yourself as opposed to when you look in the mirror. When you look in the mirror, and this is just a kind of a, I don't know how to say it. It's like a physiologic thing. I mean, it's like a perception thing. It's not even something that people are thinking. It's a subconscious thing.
Yeah.
When you look in the mirror, you look at specific areas, like your cheeks or your chin or your whatever it is, your nose and stuff like that. You focus in on those areas, and that's why and that's why people. I say no to people weekly, like several times a week, when they'll come in and they'll have good volume in their cheeks, borderline big.
Mm.
And they'll come in and they'll be like, well, this area is flat. And so I don't like it to be flat. I like it to be round. Can I get some more in here? And I'm like, get out. Get out now. Absolutely not. And I can't, because it's just, they don't see the full picture. They don't see the proportions. They just see this. Right.
Yeah.
And I think that, I mean, that woman takes it to a whole new level. That's what, and I think she did it, and then she I think she certainly is body dysmorphic, but I think she did it, and then she got a bunch of attention for it, and now it's like, it's her brand, it's her thing.
Right. It looks like that would make her. I don't know how she's going to grow old looking like that, because when your skin starts to sag and you get wrinkles around that could be a terrible look. Just like when people are covered in tattoos. I never
Yeah.
understand, because when you're like 70 or 80, I don't know that that's going to look so good.
I worked in my training. I worked in the veterans hospitals, right? And so I see that a lot. And those hula girls, back in 1946, they don't look so good now.
Right. Oh my goodness. Okay. All right. So as a takeaway, what would you say is, I actually am just curious. Do you have one specific, I know the story you gave about the actress who, when you changed her wrist and she started crying, obviously that sent you down a path of a new movement, but are there any other things you could tell us about that you loved, a good story about someone whose life you felt changed? And it could be about the nose or anything else. Or is it something that you just see on a consistent basis, how you're making people happier?
I mean, it, okay. So in terms of the nose, I see at this point, I see patients that nobody else can, that the surgeons don't want to operate on because they've had 3 rhinoplasty procedures and nobody else wants to inject because it's too dangerous. So they send them to me, and I'm their last hope, right? I'm the last stand. And so And when I do, and of course, first I make sure that their expectations are, are good.
And by the way, I just want to stop you there because I think people need to hear that. Expectations are like the thing that can send you down a rabbit hole of having really bad surgery because it's not the surgeon's fault. It's your fault of what you expect in your head. And I think that's a huge thing that people forget.
Yeah.
You're
And
not going for perfection. You're going for like a better look or a more
yeah,
youthful look, but it's not perfection.
and I agree. I will put it on the surgeon a little bit because the surgeon has to be not so eager to do the procedure as to make sure that the expectations are correct. So to some degree, it's on the surgeon to make sure that communication is good,
Right.
and that those expectations are appropriate. So when somebody like that comes in who's had multiple procedures, nobody else is going to touch it, and I do what and I make the nose go from looking like they've had procedures and looking really unnatural to looking really pretty natural.
Mm.
Man, that's nice. That is something that really it changes their lives because now they're not going out in public looking like they have a nose that's really deformed, right? And they're they pass. They're it's okay. Nobody's staring at them. That's really nice. And then the other thing is that what's interesting is that people come in who grind their teeth a lot, right? And they have a lot of pain in this area, and they have it for years. And they come in and suddenly, and somebody somewhere tells them, "Hey, you know what? You may want to try a little bit of Botox in that area. It may work." And they come in and they put Botox in there, and their pain suddenly goes away like that. That's nice.
Yeah.
That's one of my favorite things. It's really, I mean, that's a serious thing. It really just affects your life a lot. So
Yeah.
it's
Great. I
cool.
love that. All right. So if people want to reach out to you and find you for whatever reason they may have, tell people how they can reach you.
So, Instagram is Dr. Rivkin. The website is Rivkin Aesthetics. We have TikTok. I think TikTok is Rivkin Aesthetics. Yeah, it's Rivkin Aesthetics. TikTok
You're based in LA, right?
yeah. We're based in LA. Okay, we answer, just contact us however you'd like.
If people fly to LA to see you and do the procedure, can you can you speak with them on Zoom beforehand so that they can actually just come for the procedure? And then how long do they need to stay in town? I'm asking for a friend.
Yeah, sure. People fly in all the time for this kind of stuff because I'm at this point I get referrals from all over the country with these noses. They fly in. It's a brief procedure. There's no swelling. Most of the things that I do. There's really no swelling or no aftercare. And some people fly out the same day. I prefer if they could stay overnight. That would be nice, just in case. Especially for noses, I just want to be sure. But you don't have to stick around for that long. And
which is by the way much different than if you were getting plastic surgery. You have to be there for like at least a week, right? You got
for sure.
Yeah. And I don't think you can fly. All right, Dr. Rivkin, I really like you. I'm going to see you in LA. I wish you the best. And, I think that people should definitely look you up. And, my last question is, do you answer your DMs if people have a specific question?
Always. And by the way, to answer your question, I very commonly do Zoom consultations because I don't want people flying in here if they're not a good candidate. I want to make sure. So especially if you're going to fly in, contact us. We'll do a Zoom, make absolutely sure that you're a good candidate. Then have you come in.
Awesome. Okay. Thank you so much.
All right. Thanks.